Today in this video we are going to discuss about Temazepam. What is this drug Temazepam? The suffix azepam indicates this drug is a benzodiazepine. Here we have the suffix azepam where the term az can be obtained from the ring system benzodiazepine. And another suffix pam indicates these drugs are acting like positive allosteric modulators. So they are the modulators for the GABA receptors, but still they bind to benzodiazepine binding site, which is expressed on GABA A receptors. So they are allosterically modulating the activity of GABA so that they can increase the action of GABA, resulting in the inhibitory response. That's why temazepam can be used for the induction of the sleep. But among these benzodiazepines, temazepam is a short-acting benzodiazepine. This can be clearly observed within the structure of temazepam. Due to the presence of OH group at the third position, this drug is somewhat short-acting and this drug can reduce the insomnia in the patients. That's why it is given from 7 to 10 days in order to treat the insomnia, where this drug can increase the sleep duration as well as quality of the sleep. So today in this video we are going to discuss about this temazepam, how this drug acts, what is its chemical nature, what are the important precautions, side effects, all these things we will discuss in this video. So first of all, let us see the chemical nature of this drug. So this is the structure of temazepam. We can clearly observe the benzodiazepine ring system. Let us give the numbering to this ring. We can start the numbering from the nitrogen. So this is 1, 2, 3, 4, 5, 6, 7, 8, 9. Now the nitrogens are present at first and fourth position. So this is 1,4-benzodiazepine with a ketone group at the second position, so 2-O. So we can write this suffix as 1,4-benzodiazepine 2-O. Seventh position electron withdrawing group such as chlorine is present, so 7-chloro. And third position hydroxyl group is present, which is responsible for short duration of action because this drug produces some polarity to the drug so that this drug can be easily excreted. So third position hydroxyl group, so 3-hydroxy, then first position methyl group, and fifth position phenyl group, and third position is saturated, so 3H. That is a complete name of temazepam. So temazepam is a short-acting benzodiazepine with OH group at the third position. Now let us see how this drug acts. Within the CNS, so many types of mediators are present. One of the important excitatory amino acid neurotransmitter is the glutamate. This glutamate can be released by calcium-mediated exocytosis. Now the calcium, when enters into the presynaptic nerve terminus through the voltage-gated calcium channels, it can produce the exocytosis and release of glutamate. Now this glutamate can act on the postsynaptic receptors. One of such receptor is the AMPA. When this AMP is activated, it is coupled with the sodium channels, so these channels are activated. Now the sodium can enter into the postsynaptic neurons, which produce the excitatory response. In this way, glutamate produces excitation, but this excitatory response is controlled by inhibitory mediators such as GABA. Now GABA A receptors are present on the postsynaptic membrane. These GABA A receptors are inotropic receptors coupled with chloride channels. Now when the GABA binds to these GABA A receptors, chloride channels are opened such that chloride can enter into the membrane, resulting in the inhibition of postsynaptic membrane. So in the patients with insomnia, temazepam can act by this mechanism. Temazepam can bind to a GABA A receptors at an allosteric site where the benzodiazepine receptors are present. Now by binding of these receptors, it can facilitate the binding of GABA so that chloride channels are more open and chloride can enter to produce inhibitory response. And this inhibition results in the induction of the sleep as well as decrease in the anxiety and increase in the sedation within the patients. Now these are the GABA A receptors, which are inotropic receptors. They are made up of alpha, beta, gamma subunits. They are pentameric in nature. Now GABA can bind to these GABA receptors as well as temazepam can also bind. Now the temazepam is a positive allosteric modulator. It can bind to the GABA A receptors at an allosteric site such that it can facilitate the binding of GABA to the GABA A receptors. When GABA binds to GABA A receptors, it opens the chloride channels So chlorine can enter into the cells, which produces hyperpolarization. This hyperpolarization is an inhibitory response which results in the decreased anxiety, increased sedation, increased hypnosis, induction of the sleep, increased amnesia, loss of memory, some muscle relaxation, loss of sensation can be observed. All these effects are produced by Temazepam, but this drug is having short duration of action. That's why Temazepam is particularly indicated as a hypnotic. It can induce the sleep in the patients with insomnia. What are the precautions? One of the important precautions of Temazepam is that this drug can produce a high sedation in the patients. Being a benzodiazepine, this drug can produce a sedation, but at a high dose, it can produce high sedation, resulting in, if you have the symptoms such as dizziness, confusion, and ataxia, loss of balance, which results in the falling sensation. All the symptoms can be observed because of Temazepam, which produce high sedation in the patients at a high dose of the drug. And particularly, these symptoms are more pronounced in the elders. That's why within the elders, this drug should be used at a low dose, and the starting dose is 7.5 mg given once daily. In the adult patients, it is started at 15 mg, but in the elders, it should be started at low dose such as 7.5 mg in order to reduce high sedation and other symptoms in the patients. Similarly, Temazepam can increase the symptoms of depression. So if already patient is having any pre-existing depressive symptoms, they can be further increased by Temazepam, and even it can increase the suicidal thoughts within the patients. So in the young people with latent depression, this drug should be carefully given. Similarly, this drug can increase the risk of sleep driving. The patients may drive the vehicles without any proper memory and consciousness. And even the Temazepam can produce some anterograde amnesia, loss of current events. So all this can produce some strange behavior in the patients. So care should be taken such that patient is not driving the vehicles or working with any machinery because of high sedation and anterograde amnesia in the patients. Just we have discussed that Temazepam can produce sedation in the patients. If the patient is given with other drugs such as diphenhydramine, which is an antihistamine that can produce some sedation in the patients. Similarly, opioids, which are again produce sedation as well as euphoria. So whenever this Temazepam is given with other drugs such as diphenhydramine and opioids, the sedation is more pronounced. And when it is given with opioids, respiratory depression is also increased with the Temazepam. So these drugs should be carefully combined with this Temazepam, and the dosage adjustment should be done in order to prevent a high sedation and respiratory depression within the patients. What are the side effects? The important side effects are mainly observed within the CNS. Temazepam may produce drowsiness, dizziness, sedation, headache, fatigue, dry mouth, diarrhea, confusion, disorientation, hangover, some blurred vision, and vertigo can be observed within the patients. How it is given? This drug is available as capsule, and the initial dose of the drug is given at 15 mg given once daily. At the bedtime, this is given as a 15 mg dose for adults in order to induce the sleep. But the dose can be adjusted based on the age of the patient as well as any renal or hepatic dysfunction. In the elders, it is started at 7.5 mg in order to reduce severe sedation. Again, it is given once daily at bedtime. But the dose can also be escalated in the patients in order to produce sufficient induction of the sleep. So dose can be increased up to 30 mg given as once daily. But at this high dose, it can produce some severe sedation, and it should be carefully combined with other drugs such as opioids and other sedatives. So at a dose of 15 mg, this drug can be given up to 7 to 10 days to reduce the insomnia in the patients. So that's about this drug, Temazepam. Temazepam is a short-acting benzodiazepine, and this drug is having the OH group at the third position, which renders this drug more polar, resulting in the short duration of action. That's why this drug is indicated for the treatment of insomnia for 7 to 10 days, and it can be started at a dose of 15 mg, and the maximum dose is 30 mg given once daily. So that's about this drug, Temazepam. Thank you for watching this video.